Today on Aging Untold, when your care needs change, it could also lead to a change in Medicare coverage.
And you're going to find out a lot of things are not covered.
We'll break it down and show you how to plan ahead before the bills hit. Then, a silent health threat is leaving more people feeling disconnected.
We know right now that 1 in 2 American adults say that they experience loneliness.
We'll show you why it matters and simple ways to create more connection. Even a quick trip out can be stressful when cognitive decline affects how someone reacts in public.
How is your emotional state? How do you feel, and are you in a place of patience to go out with them?
We'll share practical strategies to make outings easier and still enjoy time together. Experts with advice and solutions. You're watching Aging Untold with Aging Well Coach Catherine Ambrose, gerontologist Sam Craddock, aging expert Amy O'Rourke, and board-certified physician Dr. Ray Rogers. We're all getting older. It's about time we talked about it.
Welcome to Aging Untold. It's easy to assume Medicare is the safety net for aging until you find out some common everyday care costs can still be out of pocket. So before a crisis forces fast decisions, let's get clear on the gaps. What's excluded, what's limited, and which steps can you take to plan ahead? Sam, when someone says, I have Medicare, what are they most surprised to learn it doesn't cover?
I think everybody that calls my office and they're like, I need a caregiver and I have Medicare, and I say, Medicare doesn't cover it. They're always so disappointed. This is the biggest one. Everybody thinks that, what do you mean they don't cover caregiving? And they just don't. And it is one of the most expensive, but one of the most needed. And that's the problem. You know, you need caregiving. You need help with your activities of daily living. And there is no coverage out there for it unless you have long-term care insurance and you had the foresight to do that, or maybe some VA benefits along the way.
The other thing that people are surprised is traveling abroad, no coverage.
Yeah.
Dental, no coverage. You really think about the neck up, no coverage. Now, I will put a disclaimer on that. Some of the Advantage plans, you can have traditional Medicare, you can have an Advantage plan, and some of the Advantage plans are branching out into providing extra eye care, ear care. So you have to really look at your Medicare Advantage plan to see what they are covering. And I really like people to go over and over back to the Medicare.gov website, because I saw on there the other day that they were covering some dental work if it was related to a medical procedure you were going to get.
Right.
So,
right.
Well, I think it's really important that people find a local Medicare specialist. And I might take some heat on this, but I'm going to say not a volunteer, because you can have a state licensed insurance person that specializes in Medicare, and they don't charge either. People think they're saving money because they're going to volunteer that's been trained for maybe a few hours. Maybe they're retired, and that could be good. But I would say get a Medicare specialist that is what they do, completely what they do, and that they will help you when you get into, sticky wickets.
and the good ones that won't sell you on one or the other, but look at you, look at your finances, look at your care needs.
Look at your medications that you need when you're doing that.
Every year.
Aspect of, do
Yeah.
you wear glasses? Do you wear hearing aids? Do you have dentures? What are your needs? And get that person that can help look at those things.
Well, and people will say, well, my medications didn't change, so I don't need to do my annual enrollment period. Yes, you do.
Yes, you do.
Because you might have not changed, but the insurance policy may
That's
have.
right.
So you've got to have that local person that will meet you face to face, belly to belly. They know you, you know them. That's the kind of relationship you need to navigate this. It is really critical. And you're going to find out a lot of things are not covered if you really want to take great care of yourself, because there's going to be some limitations versus a more holistic wellness approach.
Sure.
It's really surprising, and I think the best thing you can do, I went with my husband, I was like, whoa, and we were, the specialist that you sent me to, and she broke down all the different plans, what the differences were, even on the premium prices, what they offered, why it was different, and was there a difference between what they offered with the prices and all that, and she kind of knew the medicines that you were on.
Yeah.
Some of those are a big deal.
Yeah.
So, I mean, it's really good to sit down with somebody who really, really knows.
You said very clearly from the neck up, but from the ankles down. We have some issues too. Podiatry, there's some issues that can go on there. Yeah. So, and feet are super important to be checked and super important to be taken care of, but they're not always covered either unless there's specific medical issues.
So maybe that's just the VA. I was just thinking, what about rides to appointments? Do they?
Oh, that's
maybe
a
that's
good question.
So the Medicare Advantage plans, not traditional Medicare.
Okay. You might be surprised, though, what kind of podiatry is covered, and so you've really got to check it out. That's why I'm saying you got to have a local expert.
But what about the home modifications? Do they consider that medical?
That's
no.
Home modifications do not get covered. So where I would send people are like a Rotary Club or a volunteer club or some of the services, nonprofit organizations in your area. To get some of those home modifications. They should. I mean, I think they should, like a ramp. Come on.
There's a lot of companies, nonprofits that do grant work. And so there's a lot of government grants that are out there and available to help with those kind of things, but it's not a straight up Medicare coverage.
And oftentimes you can get a ramp that someone wants to donate, especially if you can pick it up, or there's organizations that help with things. But that means you really got to be plugged into your local resource team. Aging is a team sport.
And I think to your point, like the home modifications aren't covered, but medical equipment is.
Yes.
So that's where people get a little
You can get a wheelchair, but you might not be able to get a grab bar. Or you can't get the ramp to get in. And be careful on getting a used ramp because there are codes and there are steepness. I used to build them for a nonprofit, and so there are codes, and you don't want a ramp that's going to be too steep and then you're nose diving.
Yeah. Very good. I just have to say this again, some medical professionals have been a little sassy and they've said, or a medical disadvantage plan. And so you've got to ask a lot of questions about traditional Medicare versus all the advantage plans, and just be aware it's a touchy subject.
And it changes yearly.
Still ahead, a simple outing with a loved one can unravel quickly when memory loss changes the rules.
Your issue is to make sure that your person is safe, your person feels comfortable, your person feels connected.
We'll show you practical ways to set the trip up for success and what to do if things don't go as planned. But first, loneliness affects millions of Americans, and doctors say the health impacts are real.
Social disconnection leads to increase in stroke, increase in heart disease, increase in depression, even increase in death.
We'll introduce you to a group spreading quick, real-time moments of connection, one small gesture at a time.
Welcome back. We're talking about a health issue that doesn't always look like one: loneliness. More people are saying they feel disconnected, and research shows that can impact both physical and mental health. Now, one group is trying to change that, one connection at a time. Deborah Alfrone in Washington, D.C. has more.
Connect with each other.
Walk down this Washington, D.C. street and you can't miss the smiles, bubbles, and good vibes of this small but mighty crew.
Thank you.
But these cheery volunteers have a serious mission.
We know right now that 1 in 2 American adults say that they experience loneliness. And I think to myself, what issue affects literally 50% of American adults?
Becca Bernstein is Chief Community and Operations Officer for Belong Center, a nationwide nonprofit with the mission to end the loneliness epidemic and literally save lives.
Social disconnection leads to increase in stroke, increase in heart disease, increase in depression, even increase in death. I think a lot of people think of loneliness and belonging as these sort of fluffy, nice-to-have issues. These aren't nice-to-have issues. These are at the crux of our health and our well-being.
We sat in as Becca led a group of volunteers in what's called a Social Connection Core activation. They're getting ready to go out and perform what's called Rascals, or random acts of social connection and love. One team hopped on public transit, handed out these connection cards, and created community through a game of Pictionary. The other team hit the streets, engaging people and also handing out those connection cards. Sure, some kept walking, but more often than not, people took the cards. Some shared.
Because they have a minimum amount of family there. I am the only one in the District of Columbia. I miss the ones who are further away. And sometimes I feel lonely.
Becca says life transitions, breakups, divorce, deaths, moving to a new city can leave people feeling like they don't belong. But it can take just one person to create a ripple effect. Even if walking around, handing out cards isn't your thing. Becca says there are ways you can connect with others in your community through your own rascals. Visit your elderly neighbor, call an old friend. Your small action could change a life.
We had someone in our community who bought someone a coffee in line. The guy immediately got tears in his eyes and he said, you know, my dad's in the hospital. It's almost like you knew. But I didn't think anyone cared, but in this moment I feel like someone cares.
That caring could change a life or even save one.
Kudos. I could not love that story anymore.
Right.
I love every bit of it. I don't think that there's any more important work than just doing that. The bubbles, I'm all about it. The t-shirts, all the cute things, but everything that she was saying, that is so true. And what could have impact on 50%? Wow.
Right.
I feel inspired.
Yeah.
I think people underestimate the importance of the immune system and all that and the stress response. And you do not want the body always in a stress response. And she's exactly right. You know, heart rate goes up, blood pressure goes up, the immune system goes down. And over time, people get depressed. They get cognitive decline. They get dementia and heart disease and even early death. The studies show that. So she's absolutely right. And what a simple fix.
You know what I found so sad is to think that 50% of adults are lonely in a world that has so much social connection.
She said it's minimized, and I think it is.
Yeah.
You don't
Yeah.
talk to your doctor and say, I'm profoundly lonely.
Right.
And when that woman was on the bench and she was so forthright about it, you know, sometimes I'm lonely. I think that's the first step in saying, where can I go to get that kind of connection? Going to the grocery store, or the bank teller, and what am I doing to increase my own connections, but giving to others?
But everybody's so busy in their own little world with their own little screen and their own little problems that they've stopped reaching out to others. I mean, I come from a very rural country, you wave at everybody, you do that. And I come here and I'm like, they don't wave. I moved to California and I started setting my neighbors' trash cans out. And they were like, what are you doing? They thought I was stealing them. I'm like, you're work late.
I did something funny. I did my residency in New York City, and I live in Wichita, Kansas. So I go up there, and I'm walking down the street, and I'm saying hi to everyone. Hi, how you doing? And the lady said, come here, baby. She said, you're not from here, are you?
Don't talk to anybody. And I think we've just gotten this world that's gotten so into itself. I love to see people reach out.
And think about the person who they're there and everybody's around and they feel they're seen, but they're not seen.
Yeah.
They still feel lonely.
Wichita, one of the friendliest cities on earth, and we're just bringing Wichita charm right here to Atlanta and everywhere we go.
There you go.
We're bringing wheat to the peach.
Still ahead, among the shelves of a quaint and quiet bookstore, you'll find a beautiful love story.
I'm grateful to have met somebody that wonderful that I would stay with them that long.
We'll introduce you to the couple who make a perfect match. And up next, simple ways to make outings safer and calmer when memory loss is in the mix. We'll share some tips caregivers can use during outings. You can watch Aging Untold anytime online. Go to aginguntold.com or subscribe to the Aging Untold YouTube channel for more.
Whether as a caregiver or partner, as we age, the goal is often to live life as we always have with the person we love, grabbing lunch, running errands, seeing family. But when dementia or cognitive decline is involved, every outing can feel unpredictable. A sudden moment of confusion or frustration in public can change everything, and that fear can be enough to make someone stay home. Sam, what can caregivers do to help outings go more smoothly?
Well, I think the first thing you need to do is not worry about public perception. We always get so worried about what someone else is going to think. Their discomfort should not be yours. And so if they're not comfortable with your loved one having a cognitive issue or maybe a mental, some kind of behavioral issue or a little bit of lapse in what we would call adult judgment, that's their issue. That's not yours. Your issue is to make sure that your person is safe, your person feels comfortable, your person feels connected. And if they're enjoying going out to eat, if they're enjoying and it's not causing undue stress on them, by all means go. Maybe they don't understand the menu anymore, or they forget what they ordered, or they may say something a little off to a waitress or a clerk or something. That's okay. That's on that person to handle that.
Yeah,
Absolutely.
What I know about the Alzheimer's Association, they have those cards. It's
Right.
My loved one has dementia. I love those because if you are a little uncomfortable watching people watching your loved one, is to give them the card so you could get the pressure off yourself. The other thing I like people to think about is, how is your emotional state? How do you feel? And are you in a place of patience to go out with them? And maybe you're not, and it's okay to not go until you're in better shape. And then what do they like to do? What did they like to do? I had a woman named Jean, and we got her out, and we got her out with a family member, and she fed the squirrels, much to the church's dismay, and then she went to the dollar store.
Right.
And she did that every day. Now the family was like, we should do something different and mix it up. And I'm like, if she's happy, you're happy.
Right.
I think that people need to, as a caregiver yourself, just give yourself extra time to plan.
Right.
Because you can't do it in the same speed that you used to.
Right.
You'll get overwhelmed.
You have to know that you can't go out all day because they're going to get tired. The brain gets tired. It gets worn out. Now, while you like those cards, for me, the cards are okay, but how dare us be so judgmental about other people's behavior that we have to hand out a card?
Yeah.
That one, I didn't have to hand out cards with my toddlers and explain that they're children and they may not act the way you expect them to. So why are we in such a judgmental society that we look at somebody and we expect them to behave a certain way?
Well, and here's an untold truth. A lot of people they wouldn't know what to do or how to act. You also have to anticipate that people might say really weird or bizarre things.
Yeah.
And they might say something that gets your mother in a tither, and so you've got to have some skill that you can learn from dementia care educators.
Right.
There's videos you can watch to kind of teach you how to roll with the flow a little bit.
Next,
I always love doing things with him together. I like him.
how this Georgia couple says their weekly bookstore run helps keep their love story going, one new chapter at a time.
When it comes to the secret to a long marriage, a Georgia couple says their weekly routine has kept them committed for decades. Reporter Sawyer Bussey shows us how.
Love can be a very simple thing.
I'm grateful to have met somebody that wonderful that I would stay with them that long.
A hand on the back, a book in your hand. What does your wife mean to you?
Oh, she's she's everything.
Michael and Brooks Breedlove have been at this for more than 30 years. Dates together every week to pick up new books.
It's something we can do together.
They roll through the aisles looking for something new, something they haven't read, which is hard.
Trying to see somebody we don't have already.
Mrs. Breedlove, she gets treatment in the area, and so right after the doctor appointment, as treat, they come and visit us.
They come to Read It Again bookstore in Swanee. The shop has been around for more than 20 years.
The thing is if I don't know your name or my staff doesn't specifically know your name, we know what you read. And it makes it part of a community.
Not only do they shop together, they shop in matching outfits.
After retirement is when we started dressing together, alike so much more, particularly anytime we were going out. I figured that way she'd have to associate with me.
I always loved doing things with him together. I like him.
Sometimes love is a quiet thing that smells like the pages of a book and feels as simple as being together and liking it.
What a marriage. And I was thinking, that gives me an idea.
Oh, I can see Randy doing that right now.
Well, I know you want the purple glasses.
Yeah, exactly. Yeah, that is so cool.
Yeah, they were a cute couple, and I love that they go to a secondhand bookstore every week together.
I like that she said, and I like him.
And I like him.
I love that. And how important is that? You're married to someone that you love, but that you like them. If I could go with a good friend and we just spill all the books all over, it's just a wonderful thing that she shares it with her husband is even more meaningful.
Right.
So my dad has a friend, and he always says, hey, people come up to him, how does your marriage, you've been together for a long time. And we go out twice a week. Twice a week we go out. I'm like, wow. He said, she goes on Tuesday, I go on Thursday.
That's so funny, Ray.
That works.
Now, here's a true confession. My husband and I often dress alike, but we don't plan it. It's a weird thing.
Oh.
I could be putting on a pink. And then we start going out, and I look at him, and I think, I'm not quite sure how this happened.
That's so funny. Oh my goodness. Life is quite a journey. Life is quite a journey, and so is marriage. We're all getting older, so it's about time we talk about it. Until next time on Aging Untold.
On the next Aging Untold, your heart, your lungs, your brain, they're all on the same team, but are your doctors playing the same game?
I always tell people that the only thing that's compartmentalized are the doctors. The body is not.
We explore the benefits of whole body health and ways you can advocate for yourself.